Good afternoon. This is the October 5th Board of Health meeting, and welcome everyone. This meeting is a public meeting and it is being recorded for the record. I will pass on to our chairperson, Dr. Brophy.
Okay, so I'd like to welcome everybody to the board meeting for October 5th, okay, 2023. As noted, the meeting is being recorded, and folks, as they enter, we'll have to announce as well when she enters that it's being recorded. Okay. First item on the agenda is the approval of the minutes from the September 7th meeting. Any changes or edits, Mr. Fisk?
No, I make a motion that we approve them as posted here.
Okay, so all in favor? Aye.
Aye.
We have a hearing on that will delay for now until the occupant, the landlord, can enter the meetings. I don't see yet that she has joined. Okay. So we'll put that on hold for the moment. So moving forward, the next item on the agenda is the any word or follow up on the life sciences bio-ready community adoption of the NIH guidelines for recombinant DNA. I think where we left off last time is we had several meetings planning on moving forward, and the plan was for a consultant to come in and help prepare all the SOPs and documents based upon other communities doing this, as well as some of the community input that will be needed moving forward on this. So any update on where we stand? I think we're waiting for our funding from the mayor for the consultant. But
no, we have not received any word from mayor's office as yet.
Okay, all right. So, and Mr. May and will not be joining.
No, he will not be joining.
Okay, all right. So any questions, Mr. Fisk?
None here until we hear back from them.
Right, okay. Next item on the agenda is the sanitary health inspectors are now all under the inspectional services in the building department. So I think that was brought to our attention. The hearing today is about an issue with the building department, so we will we'll hold on that for now. Any other updates on the?
No, this is it for the inspectional services.
Okay.
And so therefore officially all the inspectors are over there.
Okay. All right. So next
Are we
item
still
is
in limbo? Are we still
Yeah.
in limbo about what the situation is with the mayor?
Yeah, I think we're still waiting for how this restructuring of the health department and the inspectional services will take place. So we are still, it's still not been sort of, I think, fully defined or to the board at least, what our role will be.
Okay.
Yeah, all right. Next item on the agenda is to go through the COVID data. There were some vacancies in hiring from the board that we were in the process of doing, as well as maybe some updates on where we stand with COVID within the city, as well as the vaccinations that are planned moving forward. So,
thank you, Madam Chair. With respect to COVID, we have received new vaccines from DPH. As I mentioned last month, DPH phased out all the other COVID vaccines that were on the market to introduce new bivalent. So presently all the vaccines are bivalent, and they are Pfizer and Moderna. And basically DPH has mentioned that they would provide free COVID vaccine to individuals up to 18 years of age, 6 months into up to 18 years of age, and then to the uninsured and underinsured. So we have the vaccines now, and in fact, we have ongoing clinics. Today there was one already also, and the nurses did 10 COVID vaccines. In addition to the COVID vaccines, which they did today, they were at a adult day care center, day health center. They vaccinated 80 people with the seasonal flu vaccines.
Okay.
So they did 90 vaccines altogether. Back to COVID vaccines, we provide them. We have them available to for the citizens and those who are qualified. And we will also pair that up with flu vaccines. And we have flu vaccines scheduled for the police early next week. And then we have one on the 19th and then another one on the 26th. That will be at City Hall for employees. As it relates to statistics, COVID statistics, the latest is that as of this morning, we had 4 new cases of COVID and then 57 active ones for the past 2 weeks. So that brings us to a total of 34,722, 34,723 confirmed cases from the inception of the pandemic to date. And total deaths, we've recorded 538 cases altogether. We still collect wastewater, sewer, and it's ups and down, up and down. So basically, we just know that COVID is here and it is with us. The numbers, we don't have the all the full dashboard for it, but we do have COVID around.
And the estimates are probably underestimates because people, this is only testing that's done with the
Yes.
has Miss
Yes.
he has joined?
He has not connected yet.
Okay. I heard something there. So, all right. And the vaccines, the clinics will be open to the public where the vaccination is going to be taking place?
Yes, we have some scheduled with Council on Aging. We also have an ongoing at the Shaw Center, which is basically where Council on Aging is located now because they are renovating their place on Father Kenny Way. And we also have, we still have the farmers market by the City Hall where we do vaccination as well. So we continue to work and basically the work continues, the work goes on.
And as far as hiring?
As far as hiring, we have 2 positions open. One is for an epidemiologist. Basically, for FY23, we did have 3 cases. I mean, 2.5 FTE basically that were hired under the grant. So presently, we're looking for 1 EPI and 1 community health worker. So that will make two new staff that we will hire to continue the work. Basically, the grant was the DPH grant that we received was amended to include all other infections in the city, all other public health challenges. So therefore, the new EPI will not be assigned to just COVID, but he or she will be assigned to work throughout the city to collect data and work to make sure that we have all the statistics and data available to see how we're doing health-wise.
Okay.
And we already received the green light from the mayor's office and the finance department to move ahead with the hiring.
Good, wonderful. So
She's having trouble audio.
Yeah, bring her in.
Just do
Yeah,
audio.
put her
also
on.
audio.
Okay, Maria, can I put you on speakerphone right now with the
Okay,
Mr. Fisk, can you hear?
I
Maria?
can now. It was off
Okay,
for a
great.
while. I can hear now.
So, Ms. Perez, this is Dr. Brophy. I did notify you that this is I'm sorry that you had such trouble getting into the Zoom meeting. Meeting is being recorded, okay? So just so that you're aware. And the request is you put in a request for a hearing from the Board of Health involving your property located at 18 Essex Street in Brockton. And your appeal is about the order that the facility was declared unfit for human habitation, your basement dwelling at that location, which violates city ordinances. So this is the hearing now and response to your appeal. So what we're going to do is have Inspector Lawton describe what his findings were, and then following that, then you can make your appeal to the board.
Hi, Maria, this is Patrick. A tenant, as you know, downstairs at your property at 18 Essex Street had initially called, and I had responded, and after taking a walk through your basement there, I realized that the work was done in an unpermitted fashion. There's not adequate square footage for tenants to be living down there, not adequate ceiling height, window size, not adequate ventilation. And I could go on and on. Egresses that are blocked or are really inaccessible. Some beeping smoke alarms, which indicates they're not properly functioning. And the work that was done there really wasn't done. It wasn't done in the best manner possible, but that's kind of besides the point. But it shouldn't be done there anyway. The fact is, Maria, that you'll have to get a permit for this work to have that space occupied by anybody as a dwelling. Okay.
Okay.
In other words, you can use it as a pool room and shoot pool down there and store your ski stuff and whatever, but you just can't have somebody dwelling, living, sleeping, eating down there.
Okay.
So just for her sake as well, is there any regulations about basement dwelling? Does it have to be inspected and meet requirements to change it from a single residence?
Yeah, so because now you have just a regular single family home, right?
Yes.
Right now, Maria. So
Yeah.
Right, so you live upstairs and you can go use your basement just like you would any other part of the home. I think it's a split level, right? Is yours? I don't remember that one, the basement hooked up, but you can't split it up. And what I'm saying is into different dwelling units like that. If for some reason you intend to do that and to keep that, you'd have to go to the building department and pull the proper permits and go through whatever that process may be, if it's at all possible. All right.
Okay.
But from here on out and from when the letter was dated on what is the date here? And I think it was August
Did you send me
24th.
letters about the reading?
Pardon me?
Yeah.
Say that again?
Did you send me letters about the reading today? About the reading today?
Reading?
the meeting.
Oh, about the
meeting.
meeting. I'm sorry. Did we send you a letter about that?
Yes.
I had called you and left you a voicemail yesterday.
No, I missed this call. I didn't hear nothing.
Yeah, and yes, you're right. But I mean, just to double check.
I wasn't know if I have a reading now
Okay,
today.
can I ask you something, Maria? In the basement right now, what is the status down there? Are the rooms still up? Are there locks on every door and things like that still, or?
Can you repeat, please?
I mean, maybe let me truncate it down a bit. Is any part of your basement occupied by anyone other than you?
No, it's just the same person. He left some things there, but
Okay.
he needs to go back pick up.
No one's living there anymore. He's got some stuff there. Excellent. All right, thank you.
I was not at court yesterday with him.
All right, Trevor.
He's I don't know when he's gonna pick the things he left today.
Okay. All right.
All right.
just because of fire.
He can't go like leave it there anymore, just to pick
Correct.
up the things.
That
Correct.
is correct, yeah.
Correct.
So right now, for our understanding, the space is no longer occupied. According to the letter that I believe, the initial letter to you telling you about the findings, and that the unit was not fit for habitation and that it had to be vacated, was sent to you on August 24th of this year. We received that notice from you that you wanted this appeal. I think based on, myself and Mr. Fisk hearing this and hearing the situation that was in place, you're breaking the dwelling is not a dwelling that's allowed within the city, and that in order to do that, and it's also been declared unfit for human habitation. And I think based on the information that we're hearing, Mr. Fisk, I believe we should continue to say that these are the ordinances, and that at this point we agree or make a motion that the ordinance sent and the current status is that we will uphold the finding of the inspector that the unit is unfit for habitation, and that we've counseled Ms. Perez on what needs to take place in order for her to allow for habitation of that area if she wishes to pursue that. So with that, I'd like to make or George,
Yeah.
Fisk, you'd like to make a motion to uphold the finding of the inspector and the decision as a decision of the board.
Botat, Maria, I just wanted to say something. I know when a lot of people come from this, I know Maria's from Cabo Verde, and I lived there for 5 years, so I understand things are a little bit different there. And I know when you come to this country, you try to do the very best, and some of the ways from Cape Verde just don't, aren't the same over here. And I know she's probably trying to do the best for the person downstairs and everything, but we have to follow the rules and regulations of the city and the codes and so forth. And like you said, we have a lot of people that could help you out if you go before the building, and they'll give you the ideas on how to do it properly and everything like that. And I think then it'll go a lot easier for you. And, but this time we have to make an emotion to, that this just can't be done. But, there's help out here. And if you go see the different people, they'll help you. And so you can do it properly. Okay, Maria?
Okay.
So the motion, George, is
Yeah, make a-
hold it, and then all in favor?
Aye.
Aye. Okay. So again, Maria, please take advantage, seek the help. People will help you in if you wish to pursue making that area a dwelling, and you can speak to the
Yes, you're more than welcome to call me. I'll put it in right there.
welcome to call Inspector Lawton,
Yeah.
and he can help guide you in the pathway that you need to go. Okay?
Absolutely. Okay, thank you, Maria.
I have one question.
Yes.
Can you have a letter to explain to me everything so somebody can help me, because I don't understand everything like
Okay.
clear.
Okay.
Yes,
So,
we can do that. Yeah.
yeah, I think Inspector Lawton, I think, can be in touch with you and
Yes,
explain the
yes.
situation. And also, as I said, he can guide you in what you have to, if you're going to, have the appropriate permits and construction take place at your home, that he can guide you as to where you need to go to get through the construction and all the appropriate things to do this according to the regulations and the laws here in the city of Brockton. Okay.
Okay.
Okay. Wonderful. All right.
I wish you the best.
Wish you the best, and apologize for the difficulty you had in getting on the call, but I think I'm glad that we were able to work it out here.
Yeah.
Okay. All right.
Okay.
All right.
No problem.
All right. Thank you for your time. All right.
Bye now.
Thank you.
All right. Great. Thank you, Inspector
No,
Lawton.
thank you.
Okay. All right.
Next time.
Ross, well, thank you. Thank you again. All right. All right. All right. So let's go back to our agenda. Yes, thank you. Okay. So I think we left off with
Irene.
yes, the
Yes,
hiring.
So basically, we're done with, I mean, I processed the information, the job description to HR. And so basically, I'm waiting for them to post. And then from there, we will be looking for any applicants. So hopefully, once we get applicants, we will do a quick turnaround and do interview and see if we could fill the positions as fast as we possibly can.
So, any questions, Mr. Fisker?
None here.
Okay, so I guess the next thing is, for a while now, we've been trending sort of issues with tuberculosis here in the city, with our nurses working very hard with a number of cases. So, and I know we've been working with the Department of Public Health about this. So maybe you can give us some updates on where we stand at the moment and the continued tracking that's occurring. And
Thank you, Dr. Buffy and Mr. Yes, yes, we have seen a trend, an uptick in the number of TB cases in the city. Brockton has approximately 10 active cases, with one pending because it's not definitive if it is active yet. So there are two phases in TB. The latent phase, where someone may be infected but doesn't have the disease. So that one case is pending with 10 active. Now, there is no outbreak because by definition, an outbreak is where you have one vector, meaning one person infect other people. Here, what we have is we have different individuals who have been in Brockton or who recently arrived in Brockton, and then they have the disease as being determined by the health officials and providers in the city. Also, those cases, if we make comparison to previous years, we have to go with what the Massachusetts Department of Public Health has available and how they collect and use the data and share it. They give it every 5 years. So basically right now, we do not have the full data for 2023 yet. So we're using the data going from 2018 to 2022. If we make comparison with what we have right now, with the last 5 years, we can say that we do have an uptick over the other previous years, each year considered separately. In 2018, we did have up to 7 cases. So basically, within the past 6 years, we would say that this is the higher number that we have had within the past 5 years. So we've had 7 cases, up to 7 cases in 2018, and then 4 or 5 in other years individually or concurrently. So right now we do have a little bit more than usual. And the justification for that is because we do have more people traveling right now. It's traveling and people socialize a little bit more openly than we have seen during the pandemic, COVID pandemic. And also because people don't take enough precautions also aside from people mobility. And so we see more cases. Plus we do have an influx of new migrants arriving in the United States and Massachusetts, not just Brockton. So, which means that the increase or the uptick in number of TB is just a phenomenon that is not just within the jurisdictions of Brockton. So,
and of the 10 active cases right now, these are the ones the nurses are following and doing the observed treatments. And for folks and Mr. Fisher notice, it takes, you're on that treatment schedule for months. So the nurses are tracking, active cases until completion of treatment. They will be followed and tracked by the nurses within the city until they absolutely complete their treatment and then can be removed from the active list. So, so it's a time related thing too, because some of these individuals are probably approaching a time period of coming off of the list of active individuals. And, it's hard to compare during the pandemic because we weren't doing a lot of testing and people weren't coming with other things. So, if you say pre-pandemic, we'd have about 7 cases a year and we have 10 now. It's not, it's not, almost every infectious disease right now is up a little bit because people weren't coming for treatment. But certainly it's worth keeping an eye on because of people coming into the city that may have disease. They have to be aware that they have it. We have to get them on treatment and they have to be observed during that time because there is always the risk that others will be infected with the tuberculosis. So we're monitoring it. I believe the state is involved. You meet with the state frequently about this. I think there are other cities in the Commonwealth that are dealing with this similar situation. So we'll just keep tracking it for now. And the nurses are able, we have enough staff nursing wise, because this is, you have to find these people and make sure that they're taking their medication every day. So there are enough nurses and some of the folks you're hired are helping with that, is my understanding.
Yes, we do have, the stretch, but the covering all the cases with 2 community health workers, because the community health workers, they have their own education that they do with the individuals as well on Zoom. And sometimes they invest person as well. But so far we're covering everyone. We have one case that we had to find some living accommodation for because of inability to provide the lodging for self.
That's what I was thinking. Since there's been an uptake, what you said from the years before, especially with the increase in migrants, are there people out in the street? Are there people out in the street you think that have this, that haven't been detected? Are there people out there looking for these people? That type of thing? Because a lot of them probably wouldn't come in. Is there a way that we know, really?
That's a great question, Mr. Fisk. There are 2 pools of individuals that we could envision. There are people on the streets who could say homeless. We had homeless before the wave of migrants. So basically, you have a significant number of the migrants that the state finds shelters like in hotels for them. Because right now, I think we have about 40 hotels throughout the state that where the migrants are given, are sheltered. But we also have individuals who are homeless on the street. Now, I am not too sure that somehow the 2 populations become one or interact. So with respect to the migrants, basically to track them requires resources, and DPH just today put out a list of individuals where they are and the total numbers a couple hours before this meeting, because we've been looking for lists for where they are and how to track them. And so that is why also the city Board of Health with the Mayor Sullivan's call, we have gathered all the providers, including the state, and we've been having a meeting every Friday in the afternoon to address this. So we also have individual parents who have kids to go to school. And so those kids, they need to be tested and to be updated, not just for TB vaccination, but for other types of vaccine if they fall behind. And so therefore the resources are being allocated to see how we can address it. So tomorrow, again, we'll have another meeting with the other local health providers and the state to see how we can manage and to make sure that we can track all individuals who could be exposed or who could be positive for TB.
That it looks like there is something being done then, which is good.
Yes. Yeah, and Ms. Smith, it's easy, you know, if you know the migrants that are being housed there, you at least have an ability to track them, right? And to assure that they're getting appropriate from a public health standpoint, it's clearly more work. And this is why the Department of Public Health is so involved in this. But to screen these individuals, make sure they are safe as they're being integrated into the community and being put into as their kids are being put into school, that all the appropriate testing and checks are being done. The homeless is a much more difficult issue. If they're not, if you approach a shelter, shelters are aware to screen for this. The community health systems are involved in that as well. So it's another area where if you step into a shelter, you're likely you're going to be screened at some point for tuberculosis. It's the homeless that don't come to the shelters that are the potential
Right.
vectors, right? But that again, contact with large groups is what causes those things to send. So within a homeless community that is not using a shelter, there's much more risk of spread of that disease. This is like the Mass and Cass area. If it's not an area where the public health checkpoints are there to allow for check, those are areas that can sort of act as nituses for an internal spread of the disease within that community. So that would be considered an outbreak. Right now, what Dr. Mansour is saying, we're seeing individuals here and there coming in, presenting, whether it's being picked up in the screening as they're coming in as new migrants to the area, or as their kids are going to school and things are being screened. But you know where they are and your ability to screen them. And so these are, it's as I say, it's happening. It's not just here, and there are other infectious diseases, similar diseases where
Sure.
we're seeing an uptick in it post-pandemic, because many people may have had reactivation of their tuberculosis during the pandemic, but never came to the healthcare system. So you would expect a bump as they start reappearing.
Now, the 10 that you have on the rolls here now that have the TB, are they considered migrants, or are they more in the homeless type of situation?
Those fall within the purview of migrants, but with some financial hardship as well. We have one US born, and then the rest of them are migrants of 4 other different demographics of 4
Yes.
different nations. So because TB is endemic, or is you find it in many other countries beside the US.
So that kind of shows where our we should look right upon that more than other things. That's kind of like that's where we got to go to.
Right. Yeah.
Yes.
And that's where efforts, I think, from the Department of Public Health meeting with the cities, and I'm sure they're doing this with other cities as well, and the resources that are going to be needed to continue this are making sure, as we point out, the nurses here, 10 cases is a lot of work
Right.
for a couple of nurses, because every day this has to happen. The reason is that it has to be observed is that if you start the treatment and stop it, you can develop resistant tuberculosis, which is much more difficult to manage and much more dangerous if we have an outbreak of resistant tuberculosis. So it's important that once treatment starts, that you complete it and that you're monitored and followed during that treatment, which means for those months you're on the nurse's radar screen. You will be followed every day for that treatment.
Well, I think that's informative to anybody that might be listening.
Yeah. So, all right. So next item, health promotion and public health working with the Mass Department of Public Health and our various organizations, and obviously even more integrated now with the Mass Department of Public Health assistance. So
Yes, we continue to do the work with DPH and all the other partners. For instance, Brockton is also has also joined in a collaborative of 4 other municipalities that includes Avon, Stoughton, Abington, and Whitman, where we work together, and anything that we need to do collaboratively, DPH will fund that.
that's great.
And also, if like the other 4 municipalities, they may not be able to use a full-time epidemiologist or a full-time consultant, so DPH would cover for that one person, and then they share, the municipality shares resources. So we're looking into this also to see how to best take advantage of it for the city. And Brockton Public School, Dr. Linda Cahill, she joins the meeting also on Fridays that we have, and we also have Massasoit Community College. It's with us, and the 2 hospitals, although one of them is still closed. I mean, part of it is open for urgent care. That's Brockton Signature Healthcare, and also Brockton Neighborhood Health Center. So we have an array of individuals that we work with, including behavioral health, to see how we can really address the issues face the city.
Yeah. Right. So these are both the health issues and the mental health issues and behavioral issues, as well as the medical related.
Yes.
Yeah. Yeah. So, great. So yeah, and so that's great to hear, because now because many of these small towns probably don't have individual people for like epidemiological work, but it's nice, and it's certainly for Brockton gives us extra resources in managing the situation here. So, all right, so I think you gave any update on the Brockton Hospital. I think as far as we know, it's still on track for.
Yeah, as far as I know, they are on track to open early spring 2024. And then they update the city mayor's office bi-weekly. There is a meeting every other week to give a brief update on how the repair is moving forward.
And at this point, it's still just the urgent care area that's opened at the moment.
Yes, I think there is another unit that is supposed to open up, but I don't know where they are with it, and I don't recall specifically what that particular specialty is.
But they have not opened yet, so
no,
you will find out at the next meeting. So, okay, great. Thank you. Any questions, Mr. Fisk?
None here.
Okay, and I guess we're at this point we are continuing the meetings.
Yes.
As a virtual meeting or whatever, sort of hybrid meeting of either in person or online. So
yes, and that is authorized until March 31st, 2025.
Okay, all right. So another full year potentially. Okay, all right. All right. Any other items on the agenda, Dr. Montesor, Mr. Fisk, that?
Well, I'd just like to bring up the usual. You know, you go around the city, and you know, these folks that don't mow their lawns. You know, it can breed rodents and trash that they can't see, and it's just it's getting worse. I mean, you go around the city now, and it's terrible. I mean, I don't know what the situation. I mean, or if they know how to, people know how to use a lawnmower, but it can breed a lot of more, animals. And rodents and the trash that you don't see that's mixed in with the high grass and everything like that. I mean, it's not a good, first of all, when people coming in the city. And then, of course, I still see the people that panhandle. One of these guys is going to get hit one of these days. I saw somebody nearly got hit the other day. Whether they're, out of their minds, or it might be a hazard there, One of them's going to get hit and killed one of these days. So those are two things that, I see more than anything in the city. I don't know what but it needs to be addressed. It really does. Before something, happens.
Yeah. No,
Oh.
fully agree, because, public health is a broad topic. It's,
Yes.
And it includes things like homelessness, mental health, all these services, as well as, the inspection, some of the inspectional services. So it's not just the inspectional services and giving the vaccines and holding the health fairs that we have. So, it's a difficult time because it's very short-staffed in the healthcare industry right now. So we're very lucky to have the nurses that we have. We're very lucky to have Dr. Mansour here. We're very lucky to have all of the staff that we have. We're working pretty hard to keep up with the demands. So, I agree. There's a lot of work to be done here, and hopefully, as things reorganize within the Department of Health, that these issues.
Maybe those things will be addressed. Maybe those things will be addressed. more.
Yeah, and resources. The issue is bringing the resources to make it happen, which is difficult. So,
Right.
times. So, all right. If there's no other items on the agenda, make a motion to adjourn.
I make a motion to adjourn till
All
next
right.
month.
Till next month. Okay, take care. Mr. Chris.
Take care.
Thank
Good
you.
to see
Thank
you
you
all.
so much.
Thank you.
Take
Bye-bye.
Yes, have a good rest of the week.
Bye-bye.
You too.